Hi, my name is Brian Wormers, and I get to talk to you about the clinical experience poster submission and presentation for nursing capstone. And so, looking at your coursework, the first thing you might see here is the clinical experience poster submission. There is a template for you to use, and we're going to go over that here very quickly. But within this heading, you're going to see the rubric, this information about the assignment, and a guide for what to use for your template for your poster. So, key things with this, you need to submit this by January 31st at 8 a.m. as a PDF file. I will take this, whatever you submit, I'm going to take and go to Staples and print it off. I am not going to proof it. I am not going to review it. I'm just going to take it to them, and when they say that they are printed out, I will bring them back to you. Make sure that you have people review these, look over your posters for you, and look for any grammatical errors. Make sure it's clear, legible, readable, all those kind of things that you know about. So, your poster template is going to look like this. So when you click on it, you got your USF banner with title. Change these out, put your title in, student name, and then fill in these different areas. And you're going to see that they're going to have specific requirements for these areas. You can change this up a little bit, but I would generally keep the same format. You can have an image in here if it's appropriate, and you can do whatever makes it pop. But make sure you cover these areas. Make sure that you don't change the printable size or anything like that, because it is set up for the printing that we will do. So you can use all this stuff, and you've done that before, so I have full faith. If you have questions about the poster and how to make this, let me know or let your faculty know. So now getting into more of the specifics. So if we go into the instructions and then the rubric. So the instructions are, so this is a clinical experience poster submission. We want you to demonstrate your excellence that you had in practice. We want to hear about a case study about a patient that you had, and look holistically at that patient. You're going to cover all these main topics on this, and you're going to get credit for it. It's going to be that easy. So, that being said, you do have a maximum time limit of 10 minutes. Make sure that you stick within this. You will get docked if you run over 10 minutes. You need to cover everything, but at the same time, you need to be succinct. So, you will present this poster to the USF community. That will be on February 6th at 12 o'clock in the Jeske Auditorium. Or not the auditorium, but it'll be in the entrance into that glass area, and even in the green room down below. But on February 6th, you will be presenting to the USF community at noon until 1. Prior to that, you will have to record yourself presenting on your poster. And that is what we're going to use to look at making sure you covered all the things, and we'll line up the rubric and score you based on your presentation on LMS. So, that being said, some of the main components of this, you're going to focus on a complex patient or an interesting patient, one of the patients that you had during clinicals. Introduce your patient, but be very leery of breaking any HIPAA. You should not say the hospital that you're in, that the hospital that they came from, the town that they're from, what town you're in currently. So it's going to be, I had a clinical preceptorship in an emergency department in the Midwest. That open, that broad. We do not want people to be like, oh yeah, I come from Lamar's, Iowa, and I remember this patient got flown out on this date and this date, and blah, 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 blah. I never met them before, but I know exactly what you're talking about. We do not want to break HIPAA. If you break HIPAA, you will get a 0 for this assignment. So make sure that you fully understand that. Specifically, we do want you to do a nursing assessment. What did you do? What were your findings? What were normal ones? What were abnormal ones? What were labs were drawn? Were they normal or abnormal? What did they indicate? What were your diagnostics? Chest x-rays, MRIs, CTs. If you want, sometimes radiology can print you off a blank copy of an interesting finding. I would say generally don't do that because you don't want to break HIPAA and you don't want to be responsible for that. Maybe you could find an image online that would be indicative of like a pneumonia or a situation similar to this, but it wasn't necessarily your patient. And that's all right if you want to add that to your poster, as long as it doesn't overwhelm your whole poster and take it over. But what were those diagnostics? What was it? Positive? Was it negative? What were the specific findings, and what does it mean? What were some of the medications that your patient was on and why? So what were the indications of all those different meds? You will have 3 nursing diagnoses. These need to be the top priority. Everybody has got risk for falls and risk for skin breakdown. Yes, I know. They are real. I take it serious. But at the same time, I want your top priority nursing diagnoses. Do not just do the basic generalized stuff. This should also include 1 psychosocial diagnosis about your patient. So, 3 of your top most pressing priorities, 1 of which has got to be a psychosocial. Planning an outcome, you got to address, how did you care for this patient? What were their needs? So what were your outcomes? Were they specific, measurable, achievable, relevant, and what time frame? You can have short things like during my shift, during this week, during this hospitalization, prior to discharge, or long term, like in 1 year. Your goals are going to vary depending on your patient, and I can't come up with every exact situation, but realize you should have a mixture of short-term goals and long-term goals. And while you need to have at least 2 outcomes for each nursing diagnosis, so this is a total of 6, it might not be a bad thing to have 1 short-term goal and 1 long-term goal related to your diagnoses and your nursing, your nursing diagnoses. Implementation, what did you do? What were your interventions? What were the outcomes of that? Did it help? Did it not help? Was it indifferent? How did you promote their health and prevent diseases within them? What cultural considerations did you implement? What was their religion? Did you have any sage? Did you have any ambulance? Did you have a rosary in the room? I don't know about your patient, but what did you all do for them? And then what were your coordination of care concerns? Who did you all work with? Did you work with providers, social workers, case managers, respiratory therapists, PT, OT, speech? Who did you all work with on this patient? Because for some of your patients, they're going to be very complex and they're going to need a lot of different people to coordinate their care. And then evaluation. So what were your outcomes? Were they effective? You'll learn that this is not reflective of you and your ability as a nurse. You'll set your best goals, you'll set your best outcomes, and sometimes they won't get hit, and that's not a negative thing on you. So, were they effective? Did they work? Did they not work? Were they met? Were they not met? And just be honest about that. List any changes that you would do on this. If they didn't meet them, then okay, well, we change, we adapt, and we meet our patients where they're at, and we go from there. So, what would you change, if anything? And then, did you achieve it? And if not, then what'd you do? So, as a final reminder, do not break HIPAA. You will fail this assignment. I don't know how, I cannot be any more clear about that one. So, and we're going to switch over to the rubric now to see the details of this, but remember this is also less than 10 minutes on your presentation. So, you've got a lot of things and you have to be precise on this. So, that being said, we'll close out of that. We'll go into the rubric. So the things that we're looking for is just as we talked about. So, was it exemplary? Did you cover everything? Did you cover most things? Did you meet the standards? Did you fail to meet standards? Was it inadequate? Or, even missing? So, nursing assessment. What were your findings? What medications were on? What diagnostics were done, including labs, imaging, etc., etc. Nursing diagnosis, top 3, including one that is psychosocial. Priority nursing diagnosis, remember. Planning, SMART goals. I would like the idea of doing, you've got 6 of these planning outcomes that you're going to have. Make one that's short term and one that's long term for each of your nursing diagnoses in the unit. This is going to have to change depending on your patient, what your patient's needs are, and what services you are providing. But I think it's good for you to think about short-term and long-term. Looking at the implementation, what did you do? What was your interventions that you did? How did you promote their health, prevent diseases, cultural considerations, coordination of care, all those things that we just talked about? And did you do that? Evaluation, was it effective? What would you change? What were your outcomes? All those kind of things. And what depth did you do? Graphics, how did the poster look? Was it free of grammatical errors? Was it clear? Could you see it? Did it catch your eye? Etc., etc., etc. Didn't break HIPAA. References are available, so you can just say available upon asking and make sure that you have them for when people like your faculty might ask for them. And then this, don't have to worry about this because we'll print it out for you. Organize, have a professional delivery, so when you're recording this, you can choose how you want to record this. You can use the One Button Studio over in the library if you want, or any other modality that you wish, but you have to record this, and this is what we'll be grading your poster presentation on. When you present live, make sure that you're dressed appropriately in business attire and that you have professional communication. Once again, your presentation should be less than 10 minutes. So we want you to be logical, fluid, clearly articulate key concepts, and try to be as comfortable as possible with this. So watch your nonverbals. So I know it's a lot to go over, but this is a pretty big assignment, and I want you to fully understand what you're undertaking. If you have further questions, feel free to reach out to me or your clinical faculty that will be grading this, as we want to help you with this. I cannot wait for this. This is always a highlight of my year, is watching you grow and develop and taking care of patients and hearing about the experience that you had. So that being said, I'm going to wrap this overview up. If you have any questions, like I said, please talk to us, and we will see you soon.